is Dr. Mohan Sundaram. Today's topic is atrial fibrillation. So, what is atrial fibrillation? It is the irregular heart rhythm of the upper chamber of the heart. Atrial fibrillation is characterized either by an ectopic focus in the atrium or re-entry at the AV node. So, instead of sending electrical signals in a steady pattern, many different signals are produced at the same time. So the atrial rate is maybe around 300 beats per minute. Most of the impulses are blocked at the AV node. The ventricular rate may be slow, normal or fast. It ranges from 75 to 200. What is the etiology of the atrial fibrillation? The most common cause is chronic hypertension. Then heart disease. It may be due to heart disease. Mitral valve disease, maybe myocardial infarction, maybe due to left ventricular hypertrophy or cardiomyopathy, atrial fibrosis, atrial dilatation, coronary artery disease, or congestive heart failure. Maybe due to toxicity causing overstimulation of the heart. It may be due to hyperthyroidism or hypothyroidism. Excessive alcohol intake may be due to pheochromocytoma, caffeine, theophylline, cocaine. Then it may be due to some surgeries, pericarditis, pericardial trauma. Then may be due to pulmonary disease like a pulmonary embolism, or maybe due to sick sinus syndrome. Systemic illness like sepsis, malignancy, diabetes mellitus. So the clinical features, how it will present. An irregularly irregular pulse may be present. Then the symptoms may be like palpitations, dizziness, angina or syncope. And it may show fatigue and exertional dyspnea. So blood stasis may occur. It leads to formation of intramural thrombi which can embolize to the brain. So how can you diagnose this? The first and foremost is diagnosis may be the first and foremost thing is the ECG, electrocardiogram. In ECG there may be an erratic baseline, irregular baseline with absent P waves in between irregularly spaced QRS complexes. So irregular RR intervals may be seen. So in blood test it may be we can take for troponin and CKMB levels. So this shows the muscle damages of the heart due to ectopic beats, irregular beats, so a number of beats, muscle damage can occur. So you can go for serum electrolytes. So the underlying causes, you can rule out ruling out the underlying causes. So what is the management of atrial fibrillation? So first we have to check out for whether the patient is hemodynamically stable or not. Whether he is stable, then you have to go for a rate and rhythm control. For that, what are the medications can be given is beta blockers, metoprolol, carvedilol, and an alternative calcium channel blockers as diltiazem or digoxin are preferred. So when the patient is having atrial arrhythmias beyond 2 days, then we have to go for anticoagulation therapy. So what is the CHARTS score? Here comes the CHARTS score, CHADS. So C stands for congestive heart failure, H for hypertension, A for age more than 75, D for diabetes, S for stroke or TIA gives 2 points. When the CHART score is more than is 0, then go for aspirin. When it is 1, it is go for aspirin. When it is 2 or more than 2, then we can go for anticoagulation therapy like a dabigatran, rivaroxaban. So dabigatran is an oral direct thrombin inhibitor that has been shown to reduce the incidence of ischemic stroke compared to warfarin. So, rivaroxaban is an oral factor XA inhibitor. So, apixaban is also an oral factor XA inhibitor, is used for stroke prophylaxis in patients when short score is 2 or higher. So, when it is hemodynamically, when the patient is having atrial fibrillation, when he is hemodynamically unstable, when the patient's condition is getting worsened, we have to go for electrical cardioversion or pharmacological cardioversion. The most preferred is electrical cardioversion. And the pharmacological cardioversion, what are the medications given is amiodarone, propafenone. So in congestive heart failure patients, amiodarone and dofetilide are used. So these are all about something about everything of atrial fibrillation. This can be very useful for UG students. So like, share, comment and subscribe my channel. So please feel free to comment the pages so that I can give answers at my best level. So thank you.